This is meant to be a discussion though, so when we get to that part of Vicki's presentation, please ask questions. Go off mute and talk, or talk into the chat box if you feel more comfortable with that. I think there's even an option to like raise your hand on Zoom, so feel free to do that, but this is meant to be a discussion, so don't be shy. If you are having technical difficulties, you can email me, or you can email Linda, who sent you the reminder, or again, just go into the chat box. So to kick us off today, we are here with Vicki Coyle, the CEO of Meals on Wheels. We're very happy to highlight this organization today because they have had quite a year. So after the successful merger of the two organizations serving Lehigh and Northampton counties, Vicki took the helm. And not long into her tenure, the pandemic descended upon us, and Meals on Wheels had they had to face an entirely new set of challenges and pivot, which Vicki will talk about. I personally enjoyed getting her COVID-19 updates. I don't know if anyone else were on those distribution lists, but oftentimes it did bring me a smile at the end of a long day. So thank you for sharing that news, Vicki, in a lighthearted but really important way. The pandemic continues, of course, and Meals on Wheels, their work is more necessary than ever, and as seniors remain at home and in need of nutrition. And by the way, Vicki decided they weren't busy enough, so they're going to launch a capital campaign, and she will also be talking about the plans there. So thank you, Vicki. I'm now turning it over to you.
All right, thanks, Erica. So this is my first time doing something like this, and I'm not sure if I'm going to be able to see the chats, etc. when because the video is going to take up the whole screen. So honestly, I'm okay if you guys just want to unmute yourself and ask a question as we go through the proceeding. I don't mind being interrupted. It's not really scripted, so we can just roll with it. So I will, I'm going to start off by saying I'm starting with some basics of Meals on Wheels because I'm not sure how much familiarity folks have. When I looked at your participant list, I can see that there's a number of people who know what we do and how we manage over here. But for those of you who don't, then we'll just kind of do some basic conversation about Meals on Wheels. So I'm going to go to my PowerPoint. Let's see, click on that, share. All right, everybody sees. We don't need that. Okay, here we go, I think. All right, you guys don't need that. All right, so I am, yeah, there we go. That's better. Okay, so here is my first page, General Meals on Wheels of the Greater Lehigh Valley. And our mission, improving the health, well-being, and independence of homebound seniors and adults with disabilities. So yes, we take meals directly to people's homes, but there's the piece of social connectedness involved in what we do that really contributes to the well-being and hopefully increases folks' independence because they're more comfortable and connected living at home. But clearly our main mission is the food. And so you can see here one of the comments of one of our national folks that the nutritious meal and friendly visit and safety check is really what helps seniors cope with three of the biggest threats to staying at home: hunger, isolation, and loss of independence. So in Pennsylvania, the senior population is, oh, sorry, I just want to check my time, is over 60 years old. 25% is over 60 years old, and 27% of them are food insecure. 26% live alone. There's a decent number that are impoverished, and 30% have a disability. I'll go over the stats of specifically of Meals on Wheels clients in the next slide or two. Our folks are members of a population that are high risk to chronic medical condition. So to get Meals on Wheels service, you have to identify as someone who has a chronic medical condition and there's something that gets in the way of your ability to manage and prepare a healthy diet. 65% of our clients are women, 82% live alone. That's huge. So when we talk about the social connectedness, you can really see how that's important for the majority, and in fairness, almost all of our clients. Our volunteers do play a strong role in keeping people socially connected and addressing social isolation in the simple fact that they're just delivering the meal. Unfortunately, now with masks, it's a little hard to see the smiling face of the volunteer when they're delivering. But we've just continued to receive some incredible stories from volunteers about how they're connecting with people and how they're improving the independence and the life of the senior. I heard from a volunteer today that she was talking with this client, and the client really was depressed and struggling to get around. The client was feeling unstable. The client had actually tied her own leg to the walker so that as she moved through the house, she would have more stability. So the volunteer calls the office after making the delivery, tells us about this. Our client services manager calls Lehigh County, because this was a county funded client. And the next time the volunteer went, the client had a wheelchair. So, you know, county caseworkers aren't in touch with these folks on a daily basis like we are. So when we observe that kind of a situation, when a volunteer talks to someone who's depressed or having trouble and relays that back to the office and we follow up on it, it usually does result in that kind of problem solving. Either the county or we'll get involved to help folks. There was another situation where last week where a volunteer had talked to a client who was really down and really depressed. And it turns out that that was the date of her husband's death anniversary about 2 years ago. So again, the volunteer stayed for a bit longer, talked to the client, left after she felt that the client was in a little bit better place. 70% are low income, so that's living on $1,400 a month. That's pretty poor when you take into account the cost of housing. And you can see in the next stat that 68% of our clients are tenants, so they're not homeowners. They may not have the homeowning expense, but clearly they're at the mercy of increases in rent from their landlords. Like I said, they're all homebound and they have multiple chronic diseases. Here's a map of where they live. You can see that the bulk of our clients are going to be in Allentown, Bethlehem, and Easton. We do have a nice selection up here in Bangor. So here, our office in Bethlehem is kind of around here on Fritz Drive. So we have a truck, a big box truck that takes the meals from here over to Trinity Baptist Church in Allentown. And then our Lehigh County volunteers meet up to get the meals, and then they go off in these directions. Bethlehem volunteers will come to the office and go off in these directions. We have an Easton drop site right about here, so the Easton folks will pick up. And if Antonia Griffo was on the phone today, she would probably chime in that that's where she goes to pick up meals. And then we have a drop site up in Bangor. We have started picking up clients in Carbon County, and we serve Palmerton now and Lehighton and a couple folks in Jim Thorpe. If it gets too far up in Carbon, we'll call Monroe County Meals on Wheels, because that's a bit too far. We don't have volunteers up there. Palmerton Meals on Wheels currently supplies the volunteers for that area. So we have 3 core programs: our home delivered meals, Market on Wheels is our grocery shopping program, and Anna Meals is our pet food program. So all our meals are approved by a licensed dietitian. They are all within the 1/3 RDA set by the state for senior nutrition guidelines. That's a requirement for our contracts with the counties, etc. We will customize the meal to a crazy extent. These are just some of the basics. So if someone has diabetes, if they're not chewing or swallowing well, we will make the accommodation up to 52 personal preferences, in addition to medical conditions. So if I say, I'm not going to eat that spinach and I'm not going to eat carrots, the case managers make a note of that, and I will never get spinach or carrots in my meal. The difficult clients are those that don't like, pasta or rice, because it means that they're going to see the other starches repeated in their meals more frequently. If you don't eat potatoes, then, you're going to see more rice, and what else, pasta and things like that. So the pickier you are, the fewer selections you're going to have. But again, the philosophy behind that is we want the people to eat the full meal when it gets delivered to them. And we don't want someone throwing away, one of those sections in the tray because they don't like it several times a week. It means they're not getting the nutrition that they need. So this is just our sample menu, 2 items from the sample menu. We do make we make everything here, which you'll see in the video in a few minutes. Some things we buy pre-made, but for the most part, like on this menu, cauliflower salad, we would be making that here on our own from scratch in the back. Our Market on Wheels program is our grocery shopping program. So this past year, we served almost 400 clients who couldn't otherwise get to the grocery store. I was just on a Zoom call with AARP, and they were talking about how much everything can be done virtually for seniors these days. That's really not an option for our clients, because to do that, you've got to have some disposable income to pay for your Wi-Fi and your internet connection, and most of our folks don't. They don't have computers. Some might have laptops, some might have a smartphone, but I don't know. I find it a little difficult to use my Wegmans app to make my grocery list. It's a little too small sometimes to either see or maneuver with my fingers. So the program we have is the client will call in, they'll talk to a staff person or a volunteer, they'll place their grocery order. We go to about 3 different grocery stores, then we hook them up with a volunteer who will go out, pick up the order form, go out, shop, and deliver the groceries to the client's home. And then we usually have a SNAP card or a credit card on file that we'll charge at the end of the month. During COVID-19, it was really difficult to manage this program because a lot of our grocery shopping volunteers dropped out for pretty obvious reasons. As I mentioned, most of our volunteers are over the age of 60, 65. So at the beginning of COVID, they were feeling pretty compromised themselves going into public places like a grocery store. And then there was a difficulty with trying to get some basic items in the grocery store. So the program was scaled back a little bit. Right now we're trying to revise it in the event that we hit another COVID type event. Without this, a lot of our folks aren't going to get some basic food. So they might only get our meal every day if they can't get to a grocery store. And using, the online services like Peapod or whatever at Giant really is not an option for most of our clients. The Animeals program I mentioned is, and these are all real client pictures, by the way, in this presentation. Our clients really, I have to say, are very cooperative. Some are super excited to have their pictures taken. I think this lady with her service dog was. They both look pretty happy. Yeah, so these are all real clients. Animeals is our free pet food program, basically. So we know that pets boost physical and mental health, and there are innumerable studies out there that make the connection between good physical and mental health and pet ownership. What we have found is that if a client has a pet whom they love, they're going to feed some of their meal to the animal. And again, we don't want that. We want the client getting all the nutrition that's in that tray. So if it means that we seek out grants or get donations of pet food to distribute to stop that from happening, then that's what we do. So twice a month, we will send out free dog and cat food, usually in no greater than 5-pound bags, because it's a lot for our volunteers to carry and a lot for our clients to move around. Sometimes we get some requests for bird food, not very often. I want to say we have about 150 dogs or cats and about 90-something dogs currently on our Animeals program. So a couple weeks ago, we got a huge order in from Chewy .com and took up half our volunteer lounge, and the staff were in there packaging it up. And honestly, we had to send it out over a couple of days. It was too much for volunteers to carry, especially in the heat. If a person has a dog and a cat, that could be 15 pounds of food carry in. So as you know, we are volunteer driven, pun intended. We have over 1,000 volunteers. We had almost 400 new volunteers this past year, but 314 of those signed on during the active period of COVID-19, which for my purposes, I used through the end of May. So we got those people mainly through Facebook shares. It was probably a couple people personally shared it on Facebook. I know mine, when I put it up, Congressman Wild sent it out, and then because of her huge following, people shared it, it was public, and it just kept getting shared and shared and shared. So we were crazy busy processing all those new volunteers, but we needed them. Again, when talk about the lockdown was starting about a week before, we noticed a huge drop off in volunteers. People were canceling right and left. Again, they're over 65 for the most part. I would get emails from volunteers apologizing to me for the fact that they couldn't continue to volunteer. You know, someone would say, I'm sorry, my husband just finished cancer treatment. I can't go out and do this now because I'll be a risk to him. I'm really going to miss the clients on our route. I feel so badly. What are you going to do? It was heartwarming and just really eye-opening to hear the connection that the volunteers had to their individual clients as well as to the agency. And so they drive, as you can see, 368,000 miles a year for us. The longest route we have, I think, goes from our Lehigh County drop site by Dorney Park up to New Tripoli and back and around, and I want to say that one's about 58 miles. So if you do that one, you're doing almost 60 miles on one trip. So this is our current work capacity. I don't know if some of you have been in our kitchen or not, but we're going to show you. This is the front of our building on Fritz Drive, and our reception area, which has really no room for any chairs. Kind of going through our client services department. That's my office straight ahead, which you will not get to see because it's too messy. This is our boardroom where see all those boxes, our shelf-stable food we packed. This is our kitchen. This is the hotline every morning. That piece of paper she has there in front of her is a list of what everybody gets. So you can see I'm going to pause this for a second. So when I talk about specialized meals, so today this was Salisbury steak, carrots, and potatoes. This person obviously needs a soft diet. So their food is cut up, and it looks like they don't eat beef because it looks like turkey or chicken. They don't like carrots, so they're getting pasta. Wax beans, and they don't like potatoes or can't eat potatoes, so they have rice. And then this guy is putting the individual labels on the meal and packing them in this red bag, which gets plugged into the volunteer's car to keep it at temperature. So they're coming off the hot line, going in here, staying hot, and they are packed so that the first people on the route that you get to are the first trays that you take off the top. So when you open that bag, you're not digging through looking for your client. They're right there in order. And here they are all plugged into the wall, waiting for us to go. And our dish room, which clearly needs some attention. These are the cold salads. So we made that, I think that's egg salad. This is not sped up. These guys are actually working this fast, packing these plastic bags. So this is the juice and the luncheon meat, et cetera, that goes in for the second meal or the accompaniments to the first meal.
Vicki, are all of these individuals volunteers as well?
No, these are all staff.
Okay.
So kitchen staff comes in. This is George. He's our chef. He comes in at 4. He starts work at 4 in the morning. All the other folks come in. There might be another one comes in around 4, somebody else at 5, and then the bulk of them come in at 6 a.m. to do their work. So he's back here in the chef's battery, and it looks like he is working with a bunch of zucchini that I think we got from Shoals last week. So he's probably chopping that up.
And that was going to be one of my questions too, is the food source, especially for the fresh foods like the vegetables.
So we do have what's called a Better Fresh project. We get money from Northampton County and a couple of other grants specifically to fund that project. And that, what we do with that is we use the money to buy local produce. So what happens is a couple of the local farms will call us up and say, hey, we've got, extra cauliflower. Do you need it this week? And I think what happened last week was the St. Luke's farm, the Rodale farm over at St. Luke's called us up and had a boatload of bok choy. And they were doing Asian vegetables, so they were able to chop all that up and use it. And then Shoals had zucchini, and then they made zucchini slaw out of that, which gave me a good idea. Actually, I made zucchini slaw because I had extra zucchini this weekend. So I did the same thing. So we'll use it. It'll depend how much they have and how much, how we can use it if it's on the menu that week. In our capacity, we don't have the storage room to store a lot of stuff, which I'll get to in the next video. So this is Glenn, and he's measuring out the hams. Obviously, we had ham steak on the menu that week. So he's slicing and making sure the portion sizes are correct. And
Vicki,
yep.
Were you able to keep all of your employees on staff, or did you have to reduce in any area?
Nope, we kept everybody on.
Fantastic. Great.
Yep. So these are our fridges in the back of the kitchen. This is our cold side, fridges and freezers, which are really freezing. You think cold is cold until you walk in one of these commercial freezers. Honestly, I hate I put my coat on if I have one. It's the fans in the back there. This is our cold storage. Sticks out the back of our building. It looks like a truck almost, but this is where the cold meals go. So when the volunteer picks up the hot bag, they also get one of these coolers. And again, the second meal might be in there, or everybody gets milk or juice every day. So there's a bag, again, with the client's name on it. So these are all ready to go out. Again, the hot meals. And this is the carrier room where our volunteers will come in through those doors and pick up their bags to go. Right now, we're not volunteers tomorrow actually can go in one at a time to pick up those bags. We were bringing them out, but now with everybody staying apart and keeping a mask on, they can come in and get it. This is our volunteer lounge, which we haven't used in months. Our volunteers would come in and gather and have coffee and chat, and you can see a bookshelf there, but we haven't had people come in the building for a while. And we're back at the front with our weeds, which I'll take care of this weekend. All right, so that was our current work capacity. Our COVID-19 plan, the kitchen director and I met to discuss early on, really was how can we keep meals going? How can we keep the meal preparation where it needs to be? What's our food supply going to be like? Will we be able to get enough food to make meals? And how will we manage delivery? So he immediately got on the phone and checked with suppliers. We didn't really have much of a problem with the bulk of our supplies. Sometimes something would come in and it would be in the wrong form. And what I mean by that is we got whole carrots instead of shredded carrots. So it meant that we had to take the extra time to shred them to be used in the carrot salad, something like that. Maybe he had to substitute out a starch or a vegetable, but for the most part, we were able to stick to the menu. If we had gone off menu, we would have had to ask the state for permission to not meet guidelines, but we didn't, that never happened. So he did a great job keeping our menu standard and consistent for that time. The food supply, honestly, the only thing we had problems with was getting shelf-stable items. So when I went through the conference room and you saw those boxes, we took over our conference room and packed 5 shelf-stable meals for each client, which meant they got a soup, a thing of tuna fish packet, crackers, mayonnaise, juice, pudding, applesauce, etc. And so a couple of staff, including myself, spent several hours, packing up those boxes and getting that out. We couldn't keep up. We weren't a priority at the distribution center. So if we needed, so many cases of Campbell's tomato soup, we couldn't get it because grocery stores were snagging it. Walmart, Costco, all those giant stores, they were placing the orders and their trucks were wiping it out, and we just couldn't get it. So right now we're actually starting to plan for that for the fall, and we're going to start buying some ready-made food, shelf-stable dinners, and keeping those on hand, and that way we can just take those out to people because I don't want to have to commit to putting those boxes together again in case we run into a problem with finding the components. The other issue, of course, we had to deal with was delivery. And as I mentioned before, right when everything was getting ugly, volunteers started dropping off, but we got enough. They stuck with us. As Erica said, we just communicated with them all the time, and they were fantastic. What we did was we talked, the food services director and I talked about what would happen if the kitchen shut down. What happened if somebody got sick back there and got COVID? How would we produce meals? So he ramped it up for a good 10 days and made extra meals so that every client got 5 frozen meals, and they were directed to keep them in their freezer in the event that we couldn't deliver. So between the 5 frozen meals and the shelf-stable meals, we had 10 days of food in case something happened. We set up staff and health and safety protocols. We have a lot of our staff working off-site clearly for a number of months. The fiscal department has been working at home. Somebody went to Florida. I made them stay home for 2 weeks before they were allowed to come back to work. So we did what everybody else was doing in terms of keeping staff safe. For delivery, as I said, we did the social media ask for more volunteers, developed social distancing policies around pickups and delivery, and did the daily email blast. We were very lucky to be part of the group that got a lot of free hand sanitizer. Those local distilleries were just fabulous. I joked about how one of them smelled like, a boat drink, because it really did smell like rum. I was ready to, like, please don't drink any of this stuff. But we got all that out to volunteers, and volunteers are just so resourceful. People were, making their own masks really early on, asking us if we wanted them. So we had a lot of folks who made masks for us. We got some out to our clients as well, even though they really weren't going anywhere. So we're going to take a look at, let me take a break for a second and ask, does anybody have any questions or comments about our general operation plan and anything I've covered?
Vicki, this is Mary Beth. I was wondering, can you just kind of talk a little bit about how many average stops does a volunteer make, and how many times do they usually volunteer a month?
I don't have the average number of times. I would say, again, if there are anywhere between 7 and 17 clients on a route, then that's how many stops they'd make. So it would be 1 stop per person. So a route could have 10 clients on it, and the volunteer would be stopping 10 different times. We did have issues with some of the apartment buildings with COVID. I did have problems with some volunteers who said, I'm not going in an apartment building. I'm not comfortable delivering in there, getting on an elevator and other people are getting on. Even when folks were wearing masks, volunteers weren't comfortable doing that. So we had to try and find some employees who were on staff at these apartments, because most of them were not. The county would take people off staff, and they might have a maintenance person on duty, but they never had a somebody in the office who could take meals. So then we had to come up with this protocol where volunteers would put the meal in a bag with the client's name on it, and the client would be called and they'd have to come down to the lobby of the building to pick it up, which was really hard because some of our clients aren't mobile. mean, they're really not. Like, it's not, they can't, without an aide or someone in the house, they can't get out. So thankfully, we're going door to door now in the apartment buildings, but that was pretty rough. I answered part of your question, Mary Beth. I forgot the second half because I rambled.
The second part is the volunteers. So do they work like once a week, or do they?
We have a portal online, so they can sign up whenever they want to. So some volunteers are every Monday. Some people do the second Tuesday of every month. Some people are out there. Honestly, this is one woman who is a COVID volunteer, meaning she just started. She's been just about every day. She said, I'm home anyway, I don't have anything to do. And so she's come out. And the whole shift, so for this building, you pick meals up at 10 o'clock and you could be finished by 11:30 or 12. It depends what route you have and how complicated it is. So it does vary. Some people, certainly some of the folks who've been around for a bit longer, they come out at least one shift a week.
And Vicki, this is Donna. Do you deliver 5 days a week, 7
We
days
do.
a week?
5.
5, okay.
Some clients will get a weekend frozen, so we offer that option as well. We ask clients to do at least 3 days a week, because otherwise it's too much for us too much detail on our end to do less than that. So everyone does at least 3. Some people will do a second meal. They'll get a cold bag supper in addition to the hot meal. We have what are called chef packs, and those portions are a little bit bigger. They're lower in sodium, but so we don't call them heart healthy. They really are. I mean, there's no preservatives or anything in them. That menu's on our website. And so I have a friend, for example, who can't cook. And so periodically she'll order some of those, and they're, you heat them up in the oven. I got the salmon one, which was actually really tasty when I had my knee replaced. So there's a couple of those, and soup. The soups are really, I have to say, soups are really good. And those are $2 for a 10, 12 ounce container, which is honestly a really good deal. We make all the soups in-house. So we have a couple different options for people, but certainly with our more, for regular clients, 5 days is probably is typical. Some will get a weekend frozen pack, meaning, like I said, they need frozen meals for the weekend, or they'll get a weekly frozen. So they'll get 5 frozen meals on a Tuesday to cover them. Maybe they're in treatment, kidney dialysis or something, and they can't be home every day during meal time. So that's why they might get weekly frozen meals. Some dialysis places will let us deliver to the dialysis, and the person can just take the meals home with them if they're capable of doing that. So staff can get pretty creative, and thankfully some other agencies are pretty flexible in working with us to get meals out.
And if I get the meal delivery, can I also get a grocery shopping service as well? You're not limited to one service?
Correct. Grocery shopping is $10 per trip if you are not a daily meal client. If you are a daily meal client, it's $5.
Vicki, what are the fees? What did the clients pay for the meal service? And for those that struggle with that, is there assistance available?
We have a sliding fee scale. So at the lowest end, someone will pay, and that would be if you're within 133% of those guidelines. So if you have a $1,400 a month income, you would pay $6.50 a meal. And I think the top might be $9, and that's if you have over, I want to say $50,000 a year. So we have about 6 different levels within that fee scale. So what I'm struggling with right now, to be honest, is the county contracts I have don't pay for the full cost of the meal. So if I incorporate the entire operation from soup to nuts, the total cost of our meal, including the roof, my time, everything, is about $10.50. If I pull out certain departments, such as development, part of finance, things like that, the meal price comes down to about $9. And that's what I would charge, say, the Phillipsburg program, because they don't use our our case management services. They don't use our development team because we're not fundraising to subsidize those meals. So we bring the cost down. The counties pay about one county pays about $7.85, another one pays about $5.50 per meal. So, and those are for low income folks. So what traditionally Meals on Wheels has done is fundraise for that subsidy to close the gap between what the county pays and what the actual cost of the meal is. The problem we're running into now in the last year is that both counties now have waiting lists. So if you're low income and you want to get on service and you call up Lehigh County, they will put you on a waiting list. So if the person calls us, I say, you got to pay the lowest on our fee scale. I really struggle with this, and the board and I have to have a longer conversation about it, but I'm a little concerned about starting to raise, first of all, I don't know if I could raise money for all those people who need meals. And secondly, I feel like we're just taking over the responsibility of the state and the county to provide that food for people. And once we start doing it, then they can sit back and say, oh, well, they don't need the contract, or they don't need the contract to be as big as it is. They can do this without us. So that's a real philosophical issue that we're trying to work through.
Thank you.
All right. Feel free to jump in if you think of something else. So as I mentioned, some of the issues that we had with COVID were storage issues, capacity issues. So we can only make so much food ahead of time as long as I have a place to store it. I can only buy so much in bulk as long as we have a place to store it. And we don't at this building. Before I started, excuse me, the former director, Joanne Nino, had put together a plan to expand this building here at Fritz Drive, double the kitchen space out the back. But because of the size of this lot, I just felt that it wasn't going to work for us in the long term. And that's what the board agreed. So we bought a property at 1300 Sherman Street in August of last year with the idea that we would be in it by now. Thank you, COVID-19. The capital campaign is about 2.5 million total, and we have over $1 million raised already for it. That was phase one. So we put it on hold while we were searching for the other building, and then of course because of COVID. So I'm going to take you through the new building now on Sherman Street, and we have, let's see, here's the outside. The nice thing about it with this barrel roof is that it'll give the kitchen a little bit more airflow. Commercial kitchens aren't air conditioned, so that can be pretty nasty, especially in the last week. So the front of the building, we were just out here, and this will be our new volunteer pickup area. So volunteers will be able to drive up to the dock if they want to get their meals, or they can come into the building and they'll go into this volunteer lounge, which has access to the bathrooms, and the bags will be over here. Our board conference room, office space. The kitchen is almost double the size. And this staff room, and then this storage back here is, because of this barrel roof, it's about 18 feet high. So we can get a lot of vertical storage in here. We'll be able to buy a lot more things in bulk and hold on to them hopefully at a better price, manage cash flow better. Because of all this space here in this room and in the kitchen part that won't be used yet, and the boardroom, we'll be able to compile those boxes if we need to do it. We just have a lot more working space than we do now. Our fridge, I don't know how to move this bar, but our fridge and freezer space is all down here, and that's doubled. So as I said, with our Better Fresh project, when we get too many vegetables in right now, so corn, that's a good one. We get a ton of corn. Corn may not be on the menu. It's kind of hard for us to process fresh corn, because we can't send out corn on the cob in the tray. It doesn't fit. But we'll use it in soup, and we can use it in chili in the wintertime. So we'll have a big blast chiller so we can process that fresh corn, freeze it up really fast, and store it in the freezer so that our clients can get the benefit of it later in the year. So that's the overall plan. This is the dock outside that will be reconfigured. Will be our reception area. It's kind of hard to see now, but this is a general reception. And this is a pretty cool concept, which right now there's not much we can do with. But after we get a vaccine, I think we'll be off to the races. This is our cafe area. And the idea behind this was that we could, people could rent it for meetings. So a Rotary wants to have a meeting, we can serve the lunch. We'll have, a small catering menu. If we have new preview food items we want people to try, folks can come in. We've been talking with Moravian, with Morningstar Solutions about using this location as a memory cafe. So that would be where they would come in and use this space. They would have programming for folks with Alzheimer's and other dementia-related diseases. And it's going to be a nice open space. It's accessible, and again, we'll have the food right on site. So, so those kinds of partnerships, but really kind of a marketing concept in the sense that our food is really good food, and who knows that really, unless you've actually tried some of it. And a lot of people think that Meals on Wheels food is, sort of industrial type and for low-income people, and maybe they don't qualify, et cetera. But we're hoping that the cafe will help sort of dispel that mindset. So that will be all in this area. Let's speed this up. So all these walls will come down. We'll have the boardroom. I should have told them to walk a little faster when they were going through this. But we really were lucky. We actually had put a bid on this property, and then somebody else took it and their deal fell through. So we were able to get back to the table with the owners. The nice thing about it is it's all open inside, as you can see. So the renovations, short of putting the plumbing under the floor, renovations will be pretty easy from a contractor standpoint. This will mostly be the office area, and this wall will come down and be part of the kitchen. Here's the storage that I mentioned before. We got to keep these shelves, so along with a little forklift, so we'll be able to move quite a lot of product in here and store it. As I mentioned, our staff works in a unair conditioned kitchen. So once all these tiles are redone, it'll be a little bit more comfortable, but still hot, unfortunately. I had the Kona ice truck come last week for staff. So when they took their break at 10:30, they all got a snow cone. And this is a volunteer lounge. So ideally, this will give us the capacity to serve a lot more people. We'll be able to diversify our product more, and have more. I'm going to stop sharing. Have more on in storage. So whether it's frozen food, whether it's prepared food that we've made for folks, we'll be able to get that out to people. We'll be able to pivot a little bit more easily when we're dealing with these kinds of issues like COVID or any other kind of crisis. So that's our big project right now, along with figuring out how to operate in this new environment. Any other comments, questions?
So Vicki, you do own that building right now, correct?
We do own it, yep.
And so it's through, I'm assuming, a mortgage.
Yeah, we have a mortgage because the idea is we would pay the mortgage off when we sold this building. So we do have, and they're similarly priced, so that should really work for us. Clearly, we've taken a pause in marketing this building because we can't move out of this one until we're just ready to go into that one. So we have to bridge for a little bit.
Vicki, you mentioned something about, I was trying to take notes on the cost to charge. I'm with Jewish Family Service. We're much smaller than you, but we somewhat similar. Does the charge cover the cost?
No, the client charge doesn't cover the full cost of the meal.
Is it roughly 50%, 30%, or?
Maybe 40.
Okay, thank you.
Yeah. Yeah, and I've spoken with staff over there before, one of your social workers, I think.
Probably Rebecca.
Yeah, I can't remember. I talked with a couple people, but yeah, that was because are you doing food at the community center?
No, but people come to us, we have a food pantry, but if you can't, we do deliver.
Oh, gotcha. Yeah, that was one of the issues that someone in one of, I can't remember her name, but she runs the Easton Coalition Against Hunger, and Nancy Walters. And she was telling me that something the food banks struggled with and the pantries was that they all noticed that seniors dropped off because, of course, they weren't going out, but they couldn't reach them because most of the food pantries don't require any kind of registration. So they knew that, for example, they didn't see Donna Jones come for her weekly pickup, but they had no way of reaching out to her because they didn't know where she lived. I mean, maybe they knew she lived in Harlan House, but they had no idea which apartment. They didn't have a phone number. So, I think a lot about that, about working with the pantries and trying to I'd like to identify our clients who live near a certain food pantry and then be able to connect them with the pantry so that they can get food supplemented from the pantry if they can't get to the grocery store, if our grocery program isn't as vibrant, again, because we don't have volunteers. And is there a way that a volunteer can be connected to go take the food to somebody? Because that, like I said, a lot of our clients are low income, so they can supplement, especially their shelf stable food, they can supplement it from the food pantry, but they have no way of getting there. And nobody knows that they're in need because there's no contact information. So,
Yeah, it's rather interesting. At JFS, we do have, if for no other reason, we're proud that it's a scheduling. We don't ask anybody to wait outside in the rain, the cold, the heat, the snow. So if you're going to do scheduling, we have contact information, email and phone numbers.
Yeah, maybe people are doing that now since COVID. I don't know. I think a lot of it, I'm going to guess the philosophy of not asking for information was to support the, out of respect and dignity for people who are coming to the pantry and not feeling like they're, under a microscope when they're picking up food. But like most things, that will have to change, I think, going forward.
Vicki, when you move to the new building, will any of the components from the current building travel with you?
Yes, we are. So we're working with Clark Equipment, and they are a kitchen, industrial kitchen supply place company. So they do the design work for the new kitchen as well as giving us estimates on certain components. So there's some things that will be new. So a couple of the fridges and freezers there will all be new. These we can't move. The big giant refrigerator that sticks out the back, that will go with us. It's really interesting. It's just panels. So we'll take those panels and basically rebuild it over there. Some of the things like the big kettle that, looks like a gigantic mixing bowl, some of that stuff will go. The stand mixers, the combi ovens, things like that are on wheels can go, but the built-in shelves and the sinks, that stuff won't. But whatever is not attached will go.
That's good to know. I know the foundation has funded some of the combi ovens. So it's nice to know they're going to travel with you.
Yep. Some of them, I think, I don't know the age. Some, by the time we move, one may not be worth moving. I'm not quite sure yet. But, one of the staff, when I was on this other Zoom call, I get an email that says, the freezer, everything is defrosting in the freezer. The kitchen is broken. And I'm like, oh, I'm starting to freak out. And I run out after the meeting's finished. And I was like, what's going on? Did you call somebody repair? She goes, do you really want me to? And I'm like, what? Yes. No, it turns out she was talking about the staff refrigerator in our staff kitchen. So I was like, oh, crying out loud. I just see freezer defrosting, and I think that the whole, everything in the back has been running on overdrive because of this heat, and it's starting to go. But no, we're all good. So there's always something. The chef will come in one day and say the mixer's broken, or we need a part for this. And thankfully, they've got the right people. We get it fixed quickly enough. And so one time we had the power go out. This was a couple of months ago. Power went out just as they finished on the hotline, like 5 minutes after the last meal went through. I was like, oh, thank you. Thank you for that timing. So it's always something. We were talking about our COVID superpowers yesterday at a meeting, and I said to management staff, like, what's your COVID superpower? What did you discover about yourself over the last couple of months? And, mine was sort of this adrenaline, we're going to get this done. Nothing's going to get in our way, which, is sometimes good, sometimes not. But the food services manager just said, business as usual. And he goes, I don't know what to tell you. It's a kitchen. It's always nuts back there. Anything can happen. Wheels are always falling off. You just have to be ready to pivot and rework it. He said, so, it's just another fire, maybe a little bit bigger. He just keeps shrugging his shoulders. But it's kind of life in the kitchen. We definitely have a front of house, back of house sort of mentality going on.
You kind of answered my question, because I was gonna say, since you've been at Meals on Wheels, you have kind of brought the two Meals on Wheels together through this merger. And so you've led the organization through that. And then now it's COVID-19. And so I'm just really interested in the last couple years, your experience and really reflecting on what has been the biggest challenge during these periods of time, and how is the merge impacting your organization through COVID-19?
I think, I don't think the merge has had any effect on operations during COVID. I think it's been about change. And so there's so many conversations that people have about change. People write about change all the time. We all know there's people who I think we kind of distill it down to some people hate change, some people are okay with change, some people love change. But other than that, it's change. And so, again, as I said, my thing was adrenaline, and things are going to happen and we're going to move forward. And so I think change has been an issue. Some people, although they act like they're okay with change, really inside they're not. So I think the biggest challenge during a merge is to just really kind of drill down and focus on people and make sure that they're okay with the change. And that is a really time-consuming process. It's certainly one that is valuable. So in terms of the merger and change, maybe that was the concern and the issue, was that people were still dealing with change. And then COVID comes along, even though it was a year later, they're still dealing with change and they're still not quite comfortable with it. And then COVID comes along, and now all of a sudden I'm laser focused and making sure that we're getting meals out. And so people who are not comfortable with change are now dealing with this other new atmosphere. And, I think my big focus on making people feel comfortable, as Erica said, was my communication with volunteers during COVID, because without them, we can make all the meals we want, but they're not going to get into anybody's hands. So I think the change issue is a lot bigger than people give it credit for. And it just can't be addressed kind of with platitudes and, reading Brene Brown and, all those things. It's just got to, you really just got to dig in and get down to it.
Well, congratulations on leading your organization through multiple phases of change.
Thanks. Anything else?
Okay, well, thank you, Vicki, so much again for being our guinea pig on this, and thanks to your staff for creating that virtual tour with us. I thought it was actually really helpful. So
Oh, good.
congrats to them and thank you. If anyone has feedback on this initial virtual tour, please do send it to me. We want to make improvements and continue, as I said, to host these for, well, I guess the foreseeable future at least. So thanks again for joining us today. And of course, if any other questions remain, you can contact Vicki directly or send questions through us. So thanks again for everyone's time this afternoon. It's
Thank
great
you very
to see
much,
your
folks.
faces.
We appreciate you listening.
Thank
Thank you
you.
so much.
Thank you.
Erica.
Bye-bye.
Great
Bye-bye.
job.
Thank you.
Great
Thank
job.
you.
You're welcome. Thanks.